The Ghana Health Service is dispelling claims that the HPV vaccine set to be administered nationwide in the coming days will encourage promiscuity among young girls beginning October 7. The nationwide immunization campaign will target all girls aged 9 to 14 against cervical cancer. Cervical cancer is caused by the human papillomavirus HPV. While there is no cure for the virus itself, treatment exists for health complications it causes, making vaccination quite strongly recommended by health experts. Speaking at a workshop for journalists ahead of the rollout, Dr. Selom, as well EPI manager at the Ghana Health Service, assured the public that the vaccines are safe and already distributed to almost all designated health centers.
Gotten to the point where we are ready to deploy. We've got the vaccines in country, but the mixed vaccines, the last I checked on Sunday, was in all the various regional cold rooms, and now we are going to, this week I know it's going to go down all the way to the facility. After the 7th, it becomes part of our routine. For after we finish the campaign on Saturday, if you walk into our weighing centers, you come, you have your age, we check your age, once you are within the age group, we immunize you and we give you a card. We're doing 3 doses, then the recommendation came to 2 doses, and now with so many 19 years of use, we found out 1 dose is enough. So it's possible that in the future some research is being done to see if we can do it in a lower group. But for now it's 9 years. And let me tackle the issue of the insecurity. For the Ghana Health Service, if a place is insecure, we don't ask the staff to go and do immunization at all. So you realize the places that have insecurity now, they have challenges with their immunization because things get disrupted. Then we move into if there are refugee camps, we go and do the immunization there. But if people are fighting somewhere, we don't encourage them to go and put themselves at risk. So even if the place was insecure, we couldn't do the campaign there, subsequently the children will still be covered. Remember I said we are still catching up for a period of time. So 9 to 14 years, you can still take the vaccine till you hit 14. So definitely we'll be able to get them. If they are not there in the community and they move out to a different place too, we can get them. And then to add on to the point about the vaccine, the time of the vaccine is going to be, when you take it once, it's a lifelong protection. So if you take it at 9 years, you are good to go for life. Obviously, you are supposed to also do the screening, because as I said, most of the cancers are caused by the high-risk HPV 16 and 18. But you may have other risk factors that may also lead you to get cervical cancer, which is not caused by the virus. So those ones will also help make sure that you have to go and do the screening. So when you are 35 or 45, you should try and get the screening done. And then the final thing about the making girls, in quotes, promiscuous. I think this is an argument that has been said about everything to do with adolescent girls. When we had to do gifts program too, was the same thing that was said. Everything that has to do with adolescents is said to help or promote promiscuity. I don't think that is what this is about. The reality on the ground is that whether you give the girls HPV vaccine or not, those who are having sex are having sex. That's the reality. Whether you give the girls family planning devices or not, those who have the sex will have sex. But this is just to ensure that just in case, whatever time they decide to have sex, they will not have HPV and thus develop cervical cancer. That is why. So this vaccine is not coming to promote promiscuity in girls. Quite to the contrary. Because beyond sex, there are a few other ways you can still get cervical cancer without having sexual intercourse.
Meanwhile, the World Health Organization has pledged both technical and logistical support to Ghana for the mass vaccination exercise. WHO country representative Dr. Fiona Baraka told the media that vaccination is only one element of a broader strategy to combat HPV.
So once the vaccine is introduced next week as a campaign blanket approach, the vaccine will then be part of the routine vaccination schedule for girls at 9 years of age. It's important that once it has been introduced, that we monitor the coverage to ensure that indeed we reached our target. We monitor for any adverse events, see how to tackle those. We monitor also and assess the impact down the road, which will take some years, but to ensure that the products, the vaccine we've introduced has actually had some impact on the burden here. But those are long-term kind of evaluations. So WHO supports that post-introduction phase